All right, this chapter is lifespan development. Basically, we will go through, move on into geriatric ages and kind of show the differences in what we may expect as far as when we get to these patients also. So humans evolve throughout their lifespans. We must be aware of those changes as a person undergoes at various stages of life. They may alter the approach to the patient care a lot of times. So our infants consider 1 month to 1 year. A neonate is considered a neonate is considered birth to 1 month. Vital signs at this age: birth weight 90 to 205 beats per minute. Within the first half hour, it should drop to 120 beats per minute. Blood pressure directly corresponds to the weight, and body temperature is usually between 98 degrees to 100 degrees. And neonate and infants are 96.8 to 99. It's really just due to their metabolism constantly going and being adjusted out into what I call out coming from the oven of 98.6. Being exposed to whatever weather we have here in the South. Hopefully, a warmer is ready in the OB department, but if it's not, then we may have problems there too. All right, the weight usually doubles. Correction. Neonates usually weigh 6 to 8 pounds, and then it doubles by ages 4 to 6 months, and then it triples by the end of the first year. Okay, so when you go to these patients, you need to be asking those questions. What was their birth weight? What is our weight now? If they've been going to a pediatrician, then that helps also, so that we know that they're being taken care of and they're being looked after. So usually neonates are primary nose breathers. They're prone to nasal congestion. And then the rib cage, of course, is less rigid and the ribs sit horizontally. So infant's large tongue, short narrow airway can make it more easily obstructed in the airway, just in case you have these calls. So make sure you remember the lungs are fragile. We want to see that chest rise and fall. That's pretty much it. If that's a little puff, that's as much as we need. All right, the nervous system continues to evolve after birth. The neonate is born with certain reflexes. The Moro reflex happens when neonate is surprised by something. The palmar grasp occurs when an object is placed into a neonate's palm. The rooting reflex takes place when something touches a neonate's cheek. Then they instinctively turn their head towards the touch. And then the sucking reflex occurs when an infant's lips are stroked. We have the depressed fontanelles with the sutures has completely closed in the neonates. So a bulging fontanelle indicates increased pressure, and a depressed fontanelle usually is indicative of dehydration. Those fuses usually last about 3 months, and it usually fuses between ages 9 and 18 months. All right, the birthplace we have to talk about. We have to be very mindful of those and careful with those, especially when we have trauma related to this demographic of children. So they're located on either end of the infant's long bones, and aid in lengthening of a child's bones. All right, their renal system, they can easily become dehydrated. Especially if we're not giving them the input that they need, bottles and their water consumption that they need. Just remember that their metabolism is kicked up all the time. So their immune system for the first 6 months of life, the immune system maintains some of the mother's immunities. So the infant has some naturally acquired or passive immunities, but they can also receive antibodies via breastfeeding. All right. Beginning at birth, the infant interacts and reacts with the environment. Rapid changes occur during the first year of life. So crying is the primary method of communication. They can develop secure attachments to their caregivers. Separation anxiety is common. And then infants desire to plan an organized routine. All right, toddlers are ages 1 to 3. Pulse rate is usually between 80 and 140. Respiratory rate is 22 to 37. Systolic blood pressure, if you can get them, is 86 to 106. And their temperature is beginning to normalize out. Preschoolers are 3 to 6 years old. 65 to 120 beats per minute. Respiratory rates 20 to 28. Systolics 89 to 112. Their weight gain should level off a little bit and do not have well-developed lung musculature. So this prevents them from sustaining deep and rapid respirations for an extended time. All right, toddlers and preschoolers have passive immunity is lost. Their neuromuscular growth continues. And their development of renal and systemic and elimination patterns continue also. So we start toilet training, and then teething occurs. This can be painful, and it is accompanied by a fever. A lot of times, your first-time parents, this is what they're calling for. They don't know if their young is actually sick, or you look inside the mouth as AEMT, and you're seeing that the teething is actually starting. Okay, injuries are usually unintentional. This is where they're being curious and they're out trying to do crawl and walk, putting things in their mouth that they're not supposed to. So they learn to speak and express themselves. They master some basic language, yes, no, mom, dad, things like that. They're still very attached to their parents and they feel safe with them. So at age 36 months, language does start. By ages 3 to 4, most of them can use full sentences. So we transition from using language to communicate what they want to using language creatively and playfully. They also start to learn sexual differences by observing their role models. All right, 6 to 12, here's your vital signs. Everything starts to normalize. Heart rate stays up a little bit, but everything starts to slow down. And he gained about 4 pounds and grow 2.5 inches each year. Their brain function develops further in both hemispheres. Their permanent teeth start to become in, and unintentional injuries are still the leading cause of death. So these children may have a pre-conventional reason, so the child act almost purely to avoid punishment and get what they want. They can have some conventional reason where they look for approval from their peers in society. And then there's some post-conventional reason where the child makes decisions guided on their conscience. So they start to develop self-concept and self-esteem where they want to fit in with others. All right, 12 to 18, everything starts to level off. So girls usually finish their growth by the age of 16. Boys will continue to grow until they're 18. Secondary sexual development starts to take over a lot of times. And then unintentional injuries are still the leading cause of death. They try to take control of their lives. They think they know everything. They try more privacy, especially with cell phones. Caregivers hopefully have some kind of control over their cell phones and what's going on. Their self-consciousness increases dramatically. So they are trying to create their own identities. They use feedback from their families and peers. They want to be treated like young adults, and depending on the maturity of your child is whether you can do that. And then you do also have that rebellious behavior. So peer pressure is major. They want to fit in. They want to be in with everybody and what everybody else is doing. You may have some antisocial behavior like eating disorders, some behaviors such as smoking, drinking, sex, and other high-risk behaviors kicking in. Greater interest in sexual relations, and then higher risk for other populations for suicide and depression. And I believe this is starting to increase over the years with social media and cell phones. All right, early adults, blood pressure and everything's about to be the same. Lifelong habits and routines develop, and wear and tear of bones and changes in the body tissue and muscles start. Life centers around work, family, and stress. Strive to create a place for themselves and settle down. And then marriage and children are, some of the most common things. All right, age 41 to 60, they remain the same. Vulnerability to vision and hearing loss, and then their cardiovascular health becomes an issue. Cancer incidences increases. It may show up as some symptoms of diabetes and hypertension, and then menopause can also occur. So, exercise and healthy diet can diminish some of the effects of aging, but a lot of people, due to their jobs and home life, usually don't put that as a priority. So we focus on achieving life goals. We readjust lifestyles as children leave home. Generally have physical, emotional, and spiritual reserves to handle life issues. And then we may be caring for children leaving for college and aging parents as well. So that adds some stress also. All right, here's some leading causes of death: cancer 45 60, heart disease 65 and older. Here's your older adults. What may happen, average age is 78 here. Vital signs depend on your overall health, medical conditions, medications taken. A lot of patients need multiple medications, and we need to be able to take those with us to the hospital, or at least know if there is a list of them. Cardiovascular systems decrease over age, atherosclerosis increases. Respiratory sizes and smooth muscle weakens, and surface area of the alveoli decreases. So, and we have the pictures here of a normal smooth muscle and how it decreases over time. All right, the endocrine system, they slow down physical activity, so insulin production drops off and metabolism decreases. And then renal GI systems, filtration function declines, kidney masses decreases. So the ability to clear waste from the body and conserve fluid decreases. So changes in GI function may inhibit nutritional uptake and utilization. So our taste decreases, teeth become weaker, saliva decreases, gastric motility decreases. Everything pretty much decreases and slows down. Our brain weight may decrease 10 to 20%. So that means our neural networks become slower, and the metabolic rate of the older brain does not change, but oxygen consumption remains constant. Okay, we have the age-related shrinkage. Peripheral nerve sensation is diminished and misinterpreted. So this could lead to the ability of the skin to sense surrounding becomes hindered. So most older adults can see, hear well, but pupillary reaction and ocular movement become more restricted. Hair loss is 4 times more common than vision loss. Okay. A lot of these patients live in assisted living facility. Their environments become problematic during the pandemics, and then finances may limit health access and medication. Mental function decreases. Older adults face the issue of mortality. So, with the evolution of science, people are living longer. But also with that, we have a lot of psychosocial changes. So it's going to be interesting to see over the next couple of years how our older adults adapt to these changes. Especially with the age of technology and different things like that. Be surprised at the amount of adults over the age of 80 that actually use social media to their advantage. So this is going to be an interesting study in the next couple of years.